that one?
She's here, just here.
Oh, she's this one.
This is Ayati.
Oh, I can see eating a donut.
Eating a donut. She's looking beautiful, a baby.
No, imagine a small child being subjected to drugs for what now? Oh my God, 2 years.
This baby who has suffered the multi-drug resistant TB has 7 months to go, depending on how well she continues responding to the medicine.
Prior to this, she was facing death. She looked as good as a skeleton.
On the advice of her boss, the baby's mother quit her job after a month of endless coughing and went to get tested.
I was found to have TB and HIV and started on drugs. Meanwhile, my child was deteriorating.
This is a common mistake the adults with children make.
Children end up suffering and their TB getting diagnosed at times late.
In some cases, leading to complicated TB extrapulmonary, which is outside the lungs, accounting for 2 of every 10 children with TB.
TB of, for example, the lymph nodes.
To the layers that cover the brain, and then we get meningitis. There are other forms of TB. There are those that present when it spreads to the bone. Sometimes it can present to what we call the abdomen.
It takes a year to treat it compared to the ordinary TB, whose treatment takes about 6 months. Childhood TB has not been prioritized in Uganda. It is only of recent that the Ministry of Health got a national TB focal person for pediatric TB.
Majority of people think children cannot get TB, but TB in children is a reality. Wherever there is an adult, we have to think about the children.
Of every 100 patients you see that have tuberculosis, just know that 6 of them are children below 14 years of age. But the doctors believe that this number is so low, and they think that 9 cases of children are missed out there. They know that the number should be about 15 of every 100 patients.
In Uganda, we know that TB in children is still a big problem, but we believe that it's being underdiagnosed because you can see like 30,000 adults with TB, and you can only find like reporting 700 children. Now that can't be true.
Once a week at Mulago, children are brought to the TB clinic to get their drugs, get reviewed, and get a checkup.
New cases, and we start on treatment, can go up to about 30. But now if I put in plus reattendance in a month, wow, the number is quite big. I think it goes even up to about 70 or 80.
The only advantage with children is that they are not infectious, especially those under 5.
Children get TB from the older ones, and when they cough, they basically swallow. We have to help them bring it out by either inducing them.
This is where the dilemma lies, and cases get missed. But some countries, including Uganda, have acquired some effective diagnostic tools.
A gene expert test. But still we are talking about either sputum or gastric sample, a sample that can be sucked out of the stomach, or doing a bronchoscopy and picking something from the lungs, which are procedures that are not readily available in many of the health facilities.
A chest X-ray for us in children would be a useful test. It's a simple, useful test for doing chest X-rays. They are not readily available in most of our units, and where they are, sometimes our parents have got to pay.
In the face of missing diagnostics, health workers are called upon to be highly suspicious. The call extends to adults in the community.
Children are not able to report themselves. So if we find any TB patient that we diagnose, especially those with infectious TB, these are the ones who are coughing out, who are spitting out. By requirement, we need to do a contact visit. You go home.
In 2012, globally, the WHO reported about 74,000 childhood TB deaths, all HIV uninfected. Dr. Obde, in charge of pediatric TB care in Mulago Hospital, says that to an extent this means that some children who are co-infected when they die could be counted as HIV, pneumonia, meningitis, and even malnutrition deaths instead of TB.
Younger children are more likely to get TB because their immunity is still low. That's one. Secondly, the children very commonly, especially under 5 years, depend a lot on adults, and TB is actually transmitted through the air. Other things like malnutrition, that increases their risk. HIV infection. The children who just have HIV infection have over 10 times the chance of developing TB.
The world, however, is looking towards zero TB deaths and to having about $80 million per year globally to address pediatric TB. Children account for 500,000 new TB cases every year of the new 9 million expected cases to occur annually in the world. Yet even among these, 3 million patients are missed, including children. Florence, NTV.